Welcome participants. Good afternoon or good morning, wherever everybody will be. Welcome to this institution at the Geneva Graduate Institute, and to the persons attending the side event in person and online. For the English speaking or the French, there's translation in English and French and Spanish, so everybody will be able to hear what we are saying. This side event has been hosted by KELIN, that is the Kenya Legal and Ethical Issues Network on HIV and AIDS, a human rights organization and advocates for a holistic and rights-based system of service delivery in health and for the full enjoyment of the right to health. KELIN hosts the event in collaboration with a number of partners, including the Permanent Mission of Brazil in Geneva, Permanent Mission of Federal Republic of Germany in Geneva, Global Network of People Living with HIV, that is the GNP+, Privacy International, Stop It, the Global Health Center of the Graduate Institute, the Global Governance Center at Geneva Graduate Institute, and the Center for Interdisciplinary Methodologies at the University of Warwick. The main objectives of this event are two. The first, to provide a platform for the UN Special Rapporteur on the right to health to share the thematic report on digital innovation, technologies, and the right to health. And number two, to provide a platform for the participants to reflect thereafter on the Special Rapporteur's recommendations and develop key action priorities for the development of stronger global, regional, and national rights-based standards on digital health. Madam Special Rapporteur, thank you very much for joining this side event and coming in person to give us disseminate the thematic report, which of course you have already tabled at the 53rd session of the UN Human Rights Council. It is a privilege indeed to have her here in person. At this side event, the Special Rapporteur will share key insights from her thematic report and provide an opportunity for the stakeholders to reflect on the same. The report is indeed critical in development of stronger global, regional, and national-based standards on digital health, and defining normative frameworks to guarantee the protection of human rights, including accessibility, acceptability, quality, and non-discrimination. This side event is attended by stakeholders representing the UN entities, academics, civil societies, networks of young people, policymakers, and other key stakeholders. Everybody is on board to decide and to discuss all this, which is very key and dear to our hearts, that is the right to health. At this point, I will invite Professor Sarah Meg Davis to make her opening remarks for a maximum of 5 minutes. Thank you.
Thank you. Thank you so much, Ambassador. Yeah. And it's really a great pleasure to be here. So I'm Meg Davis. I'm a professor of digital health and rights at the Center for Interdisciplinary Methodologies at University of Warwick, and an associated researcher at the Global Governance Center here at the Graduate Institute in Geneva. And my task here is to welcome you all on behalf of the Graduate Institute, both in person and online. and also to share a bit about the context for how this collaboration came together. I also represent the Digital Health and Rights Project Consortium, which was birthed here in the Graduate Institute and has now taken root at Warwick. And it's a consortium of academics, human rights lawyers, health rights advocates, youth advocates, and networks of people living with and affected by HIV. And Dr. Tlowing has been an inspiration for this consortium for some time. We've shared her concern about inequalities in the digital transformation in health, both within and among countries, including such inequalities as gender, race, language, ethnicity, geography, class, sexual orientation and gender identity, disability, and much more. And so to address this, our collaboration came together to try to develop new and more inclusive forms of research and knowledge production for the digital age that really engage diverse communities in collective inquiry and collaborative research across national borders to develop evidence that could be used to shape rights-based policy recommendations. This event today is not the conclusion of a collaboration in support of the Special Rapporteur's mandate. I would say it's more like a midpoint in that collaboration. We started off by working with a consultant, Patty Schuster at Temple University, to review literature and draft a research report to brief Dr. Tlowing on some of the issues. And members of our consortium led consultations. So KELIN, GNP+, Stop AIDS, and Privacy International met with African human rights lawyers, with young adults, with civil society groups, and people living with HIV to develop submissions for Dr. Tlowing to consider as she wrote her report. And she drew all this and many other inputs and submissions to write her report. And it really is her report. I think when you read it, you can see her voice and her intellect and her thinking really shine through throughout. And I may be a little biased, it's true, but I feel the report is important and a real breakthrough, because much of the discussion and the discourse around human rights and technology up until this point has largely focused on privacy and on civil and political rights. And as we'll see today, Dr. Tlowing takes those concerns seriously, but she frames them as among many other human rights issues, including economic and social rights, that we have to consider in making the digital transformation work for all. And especially want to highlight the, is it 2.5 pages of recommendations? It is, which is not easy, as she noted this morning, given the tight word count that they impose at the Office of the High Commissioner for Human Rights. But I think those recommendations are where we should focus our discussion today. And we as human rights people, I have to say, as a group, we're sometimes accused of being downers. We're sometimes accused of being a little depressing, not fun at parties. And we do feel it's important to bear witness to the lived experience of those who've experienced discrimination and violence online and offline. But what Dr. T invites us to do, and I think our job today, is to lean towards optimism, because that is where the real work begins. Pessimism is easy, but optimism takes effort. And that's why I say this is the midpoint of our collaboration and not the culmination. We now need to roll up our sleeves and think about how we use these 2.5 pages of recommendations, how we work together and learn together in this very new space for many of us. And there's a lot to learn, but we really need to draw on diverse forms of expertise, technical expertise, legal expertise, lived experience, social and cultural expertise, to think together about what kind of human rights we want for the future in the digital age. I think it's important in that respect, and really very proud that today's event has been organized by a human rights group from Africa. And I really want to thank KELIN and Timothy, who I've tormented for the past several months as our lead organizer, and the whole KELIN team, but also the Global Health Center team, who worked very, very hard to make this a reality, all of our co-sponsors who've already been highlighted, and last but certainly not least, our very forward-looking and optimistic funder, Fondation Botnar, and especially our program manager, Ula Jasper. So thank you very much, and I'll now pass back to the ambassador.
Yeah, thank you very much, Professor Meg. This juncture, I'll invite the Special Rapporteur, Dr. T, to give a presentation. Dr. T is from South Africa, was appointed as a Special Rapporteur by the UN Human Rights Council at its 44th session in July 2020. She's a medical doctor with expertise advocating for universal health access, HIV care, youth-friendly services, and family planning. Welcome.
Thank you so much for the introduction, Ambassador, and thank you, Meg, for saying yes when I came with this idea of having a report focusing on digital technologies and the right to health. And I think for me, it was proving how to be agile, because I'll be recommending agility to member states. So it was important for me to also start modeling some of these recommendations. And just to let you know the background, I have been a doctor, how many years, maybe 17 years now. But when social media was really becoming like the thing, we had already been on Facebook and Twitter, and they were not understood as platforms, but I was already online talking about sex and sexual pleasure and orgasms and all sorts of things. And people were like, but wait, you can't be a doctor and on Twitter and talk about sexual pleasure. Like, no, how dare you? But it was important for me at the time to do so, because I realized that there's a lot, even my own patients, with as much trust you build in the consultation room, that they were still not able to tell me because of just how formal that space is and the power dynamic of that space. And so there was a lot of online spaces by feminists, by young people, by queer young people born with HIV who were not having education and information, directly speaking to them and responding to their needs. And online spaces became the place. And so I saw them as a space to bring credibility and bring validity to people's lived experiences who were experiencing particular obstacles in real life or offline, so to speak. But the big thing was that there were no guidelines. There was no regulation, there was no ethical considerations and guidelines for medics on how to actually conduct ourselves, but also understand social media, that things live on it forever, basically. And so for me, I've always had an interest as a medical doctor in using digital tools, initially for information and education, and then very later on advocacy, very clearly around human rights. And so that's my own personal history, and I think it's important as it also influenced why I found this report important. It is based on that experience. But COVID happened, and we had been advocating for telehealth and telemedicine, for trans-affirming healthcare, for continuous mental health support, for harm reduction, for patients who are stable on their HIV treatment, for example, who need just repeat prescriptions. And we found it very difficult to find governments to support that idea. But when COVID happened, within a few weeks, everyone accepted that we're working from home. People got laptops, companies made sure people have connectivity, and even though health tools at the time were used to track and trace contact, it was clear that this is now acceptable because of a major disaster and emergency situation. And had we done the work 15 years prior, when we were already using tools as medics, we would have been much more prepared by the time COVID happened. So I think that's another lesson there. What's important about taking a human rights-based approach is that now, post an emergency state of COVID, a lot of governments will keep a lot of the things that happened during COVID. So whether it's policy changes that had to happen, whether it's the way they think about investments in healthcare, and of course then the use and utilization of digital health and innovations. There's been a rapid growth and uptake in the health system, but there's also been a rapid growth and uptake where patients, rights holders themselves are directing their health journey using digital apps. And I think that's where we are moving now, where we need to ensure that rights holders know their rights. They understand that digital technologies are not just a safe space, because when you log on an app, it doesn't immediately seem like there's just challenges on the other side or the unknown on the other side. And so I think it's important to provide that human rights analysis of where we are, of the challenges, but also give advice and recommendations to states and various stakeholders in how we can then think about resourcing digital tools without divesting in actual health facilities and public health systems, and see digital tools as something that is supplementary and not the only thing that's there. It's also important because when states are not really sure what to do, they privatize or leave things to the private sector. They do open tenders and people apply and they just leave implementation to them. And so yesterday was an opportunity to bring to them the real challenges that we know, but also start letting them know that there will be new emerging challenges with implementation. There may be blind spots that we are currently not aware of that will only come through monitoring and data and analyzing that data properly. I also spoke about that. It's one thing to have data, but you need to analyze it properly as well. And that data needs to actually make people who are usually invisible, visible. And so if we think about racism, ableism, transphobia, if you think about xenophobia, right? If you think about the challenges around migration, drug use, HIV positive status, there's a lot already in real life that makes people already living in the margins. And digital tools, if we are not thinking properly and thinking through, we run the risk of actually further marginalizing people because the issues of privacy, data breaches are more heightened. You have some states who have used the fact that data searches on your phone leave a digital footprint, so they can go and ask the police to go and trace your search history or retrieve your search history, and if they find that it's related to abortion or contraception, they may actually charge you and you may end up in prison. We know of a case now in Europe where a woman who assisted a friend get information, get an abortion, get the medication, was actually charged in prison. And so these are not just perceived issues, it's the reality. And digital does expose and put those risks to bear. Yesterday was interesting because there were a lot of interactions. I think about 78 member states took the floor, which was really exciting. And I think the honesty in the room was also quite refreshing in that, thank you for the report, it's great, it's timeless. And also we don't know some of the answers. And I was honest in saying, look, I also don't know, but I'm happy to assist you to figure it all out, using a human rights approach of non-discrimination, equality, meaningful participation that's actually consequential, because often when you have civil society around the table, people don't really take on what they say because they're not seen as experts, they're not seen as really credible. And so for me, it's to pushing for that civil society space to open in decision-making processes, but that they are also trusted to be actual experts in their lives, and that has meaning. And of course, the issues of accountability are important. And when you're thinking about business, tech, and digital companies, there's an opacity there that suits them, right? That maintains a particular power dynamic. And because they are about profit making, when you're thinking about the right to health, what it means is that our health data is up for profits. Our health data will be informing particular trends in digital design, in development, and implementation. Is that what we are consenting to when we say our phones, I'm wearing a watch, must check my blood pressure or my heart rate? What else am I giving up without even knowing that information is being used in different ways? And when there have been data breaches, who's accountable without a clear regulatory framework? Sometimes some of the data in tech companies, their HQs are outside of the jurisdiction of a particular country, outside of a region completely. And so for governments and states and civil society and rights holders, what does accountability then look like when you have trans-border data storage and data transfer? And so those are some of the more technical and not so easy to answer, but I think that's where the magic lies, that's where innovation lies. And I think for me, human rights is solution-orientated, although of course when you speak to member states, it's a language of obligation. But I think yesterday was well received, and states are really saying, in my context, the issue of language is one of the biggest issues. In another state, the issue of connectivity and infrastructure and laying down the literal cables to connect people is the biggest issue. So it's important, and for me it was reassuring that they've actually understood what the report was intending, and that they've already started to see for themselves where the gaps are. And I think today will give us an opportunity for me to hear from all of you, so that the next phase of engagement with states is also filled with insights from all of you after having engaged the report. There's only so much it can do because of the word limit. Maybe it's a good thing as well, right? Because we can, at least I can, write and talk a whole lot. So I think when you have limitations in terms of word, you get very succinct and to the point, but it's designed in a way as well, the report, to be able to be an advocacy tool. For me, at the end of the day, states will do what they do, and they're not as fast as civil society is. And so it will give me great pleasure and reaffirmation to know that, rights holders, communities, civil society organizations are able to use this to advocate for their rights, many, privacy, the right to non-discrimination, the right to accessible, affordable, acceptable and quality health that looks beyond just, like what Meg was saying, just privacy and data rights. But this is actually about, people who will perhaps no longer go for HIV testing because they think that the electronic management system is at risk of a breach and they don't want their details, known. So I'll wrap up. And then, and as an example, you may have sex workers, right, who may particularly not, go for certain services, because then if there is a network that is connected at least to the police, for example, if they go for one social service, they may be tracked easily by the police to then be harassed for getting health services, for example. So I'll stop here, and then I'm happy to participate in the Q&A later.
Thank you very much, Dr. T. I wish we had more time. Certainly looking forward to your intervention. With us in the panel is Mandeep from UNDP. Thank you very much for keeping us company during this first session. And I am Ambassador Judith Sijeni. I'm the Deputy Head of Mission for the Kenya Embassy at The Hague, Netherlands. Thank you. Here with the courtesy of KELIN. Thank you so much. I think now we'll invite Alan to take over the next session.
I'll use a shortcut.
The advantage.
So thank you so much, Ambassador Sijeni. We are transitioning to the next panel. Mandeep was very kind to keep our special rapporteur and Professor Meg Davis, which gives her the advantage to lead us in the next conversation. That is a reflection from different players from the UN, from civil society, from the affected communities and human rights lawyers. So I'd like to call onto the stage my colleagues and friends, Timothy, the two Timothys, and Joy, please come on board. We start the second session. But as they come on board, yes, please, let's give a round of applause to Dr. T and Meg, and we want to pick up from there. So I hope you have worked on your topic points to be more optimistic, Timothy, and not pessimistic, and to be solution-oriented. So I'm going to quickly, because I want us to have more time for conversation, and for the colleagues who are online, please feel free to use the chat to drop your questions and your concerns, but I want to go straight to my good friend Mandeep. She needs no introduction. She leads the HIV and health work at UNDP. She's based in New York. And under her leadership, a lot of important work has been done on HIV and human rights. I cannot spell it all, but what stands out for me for the work Mandeep has led is around the Global Commission on HIV and the Law that she led alongside our UNAIDS colleagues. It's one of the reports that kickstarted many of the legal and human rights issues concerning HIV, had very strong recommendations, but most importantly, she managed to, let me not use this word, but persuade donors to fund the recommendations and ensure funding got to various players in the UN, in civil society, and eventually we saw a lot of good work done around the recommendations, and importantly did an evaluation to be able to demonstrate that if you put money on human rights programs, you do get the results of good judgments from judges, lawyers who litigate, communities that are active in calling out for rights issues. And I remember the last issue picked up the issue of the privacy digital technology. So it's good to have you here, Mandeep. The floor is yours.
Thanks, and thanks for the kind introduction. I want to thank Madam Special Rapporteur for, I think, an excellent report, and why it was excellent, and what really, I want to just point out a couple of things which stood out to me, which will then, I think, inform how we take it forward. One was, thank you for so comprehensively connecting data and digital issues, because all too often, the discussion about innovation and scaling up the use of digital technologies, particularly since COVID, has not really focused on the issue of the data question. And so often they're discussed in two different fora, so I thought the report was really brilliant in that. I also thought the report's focus on rights-based approaches and meaningful engagement of communities and the issues of intersectionality was particularly brilliant. Because we know the lived reality on the ground, people have intersectional identities and lives, and so it really needs to be understood in that context. And again, there's some really helpful recommendations there. And I've been thinking about what can we do to help take the report forward, because UNDP is not in the business of reading reports and then not doing anything about them, or reading reports and just putting them on the shelf. So we think one of the most important things could be for the UN as part of its contribution to the Secretary General's common agenda and what the SG has called for in terms of a compact on digital cooperation, or even a code of conduct, I think was the latest thing that he's asked for around artificial intelligence, is that we must really play catch up on the guardrails that are needed for technologies. We are still playing catch up. Look at what's happened with AI, all these apps, the acceleration of the use of technologies during COVID, which was wonderful in terms of maintaining access, reaching hard-to-reach populations, but the guardrails are just not there. So I think we really have to play catch-up with the guardrails, and one of the fundamentals of the guardrails has to be human rights, and it has to be the full panoply of human rights, and not just, not just civil rights or political rights, but also social, economic, and cultural rights. So I think that's really important, and that comes out so clearly in the report. Secondly, the UN needs to play a really important role in convening. So convening private sector, the developers of technology, that could include academia as well, with civil society, with the UN, with governments, to really understand, how do we put these guardrails in place? How do we make this technology work for us, rather than us being the passive recipients of technology? And in doing that, that requires, I think, and I really like this point in your report, and we're doing some of this, but we need to do much more, is the issue of digital and data literacy. So important. Our health data has been owned by Facebook and Fitbit and, all these companies for years. Oh, it's not Facebook anymore, so it's Meta, I guess. Yeah, Meta. So these companies already, for years and years, have been quietly amassing health data. So I think now is the time to really make sure that we put that out on the table, that people understand that they own their own data. And that, for me, is fundamental to the rights-based approach to this. So in addition to human rights informing the guardrails, which we need to really urgently develop, we need to have communities, citizens at the table with companies, with academia, with governments on how technology needs to be managed in service of people's access to services and their human rights. So that's, a clear member state obligation, but it's a role we all have to play, and I think the UN has to play a proactive role in that kind of convening. The literacy will be very important, but so will the resources, and being able to have an even playing field for the consultation, because otherwise the consultation is meaningless. So, and literacy is part of it, but it's also about safety and security. And the most marginalized communities and people that need to be at the table to talk about how these technologies are affecting them need to have safety and security addressed. And that's got to be part of what the UN can do, I think, in supporting these convenings. So, you know, just looking at what's going on in terms of the erosion and, I have to say, deterioration of human rights in the context of HIV. And it's not unlinked to the deterioration of women's rights, reproductive rights. It's all a continuum. It's not, you know, they'll come for one community and then they'll come for the next and then they'll come for the next. So I think we all have to be in this together. And I think that's my last thing, is that communities really can't afford to think of themselves in silos, or, I'm a sex worker, so I'm not going to talk to the MSM group, or, you know, I'm a woman, so I don't really want to have anything to do with the transgender women. We just can't afford that anymore. I think the communities have to come together and realize that human rights is everybody's cause, and particularly in this issue around digital and data, that they work together, because I think the issues affect them all. And if you look at what's happening in some countries where there's this, you know, incredibly egregious criminalization of LGBTI on the legislative agenda, there's also egregious legislation on women's reproductive rights on the agenda. So I think all the more reason, and it's a great example of how communities need to work together. There's tremendous power in communities that can work together, and how the UN can play a role in facilitating that collaboration and that convening. But to do it with safety and security in mind, and to do it with a view to making sure that we've invested in the literacy and the, and the support that's required to have an even playing field for the conversation. And the final point is, I don't think, you know, much of the regulation that's happened so far has happened behind closed doors. And behind closed doors, a lot of lobbying and influencing can happen by companies. We've seen it in the pharmaceutical industry, we've seen it with tobacco companies, so we know that happens. So all the more reason, I think, for member states to be deeply committed to having communities at the table, and civil society at the table, and making sure that we don't have these negotiations around the guardrails and the regulatory environment that's needed in secrecy. And I did say that was my last point, but I have one more now, as I was talking.
That's how lawyers operate.
Yeah.
This is the final point.
This is the final point. Thank you for disciplining me, Chair. Is that, you know, I think everybody has a part to play. And it's, Alan, you talked about, you know, the lawyers, the judges, the parliamentarians. There needs to be some effort. We can't assume that everybody knows the ins and outs of the issues. And that's why I think this report is so important, because I think this report should be used for literacy with and sensitization with the judiciary, with parliamentarians, with lawyers, with paralegals as well, because I think it's a really powerful way of making sure that we're all speaking from the same level and same page. And I'll stop there. Thanks, Alan.
Thank you so much, Mandeep. I think that deserves a round of applause. So I'm going to turn to my good friend Timothy Fish-Hodgson, who works with ICJ and is responsible for the designing and implementation of their work on economic and social and cultural rights in Africa, but also assists a lot with their global work team. And I were young lawyers. When I met him at Section 27, he was interning, and I was also learning the ropes. So it's good to see that you're growing through the ranks. Over to you to tell us what your reflections are around the strengths and weaknesses of digital health governance at the levels you've been working on, national, global, and regional, as it links to this report and concrete things that could be done.
Thank you very much, Alan, and thanks. I'm very happy to be here. And as you've just mentioned, I was working at Section 27, and I see that my first boss at Section 27 has walked in, which is reminding me about where I come from. The other thing to say is that I want to echo what Meg said. It's really, really great to see in Geneva a very important report being released by a special rapporteur who is from an African country on a panel of civil society organizations that is predominantly people who are working in the global south and the African context, and you to be much applauded for that, because it's extremely rare. And then I can say that what Dr. T has said, I am part of the generation of people who has benefited from sex education provided by her on social media. And many of the conversations I've had with my peers about this have come from that. So if things that I say now sound critical, remember this is the positive thing you've asked me to say. I would like to make 4 different points from my perspective as ICJ. I have 2 hats at the ICJ. I lead the work globally on economic and social rights, but as well on disability rights. So the first point will be about mental health care. It might not be a surprise to anyone. The second will be a brief point about the digital divide, which will be shorter because it's being covered. The third one will be about criminal law, and the fourth one about corporate accountability. So to begin with mental health care, I think that the real issue, and this applies to many things that are covered in this report, is that there is a very big concern about quality of services provided through digital health platforms. And in mental health care, this is something which is increasingly being studied all over the world, including a proliferation of research on very widespread telehealth access in China. And why it's important is that I'm reminded of the Minister of Health back in my Section 27 days. He used to say that, there's the tendency for South Africans to paint any building white and put a red cross on it and then call it a hospital, right? Now, we mustn't be packaging, in the name of access, things which are not actually access to quality products. And in mental health, I don't need to explain to anyone why that's particularly risky. And the research on this, on a preliminary level, shows there's several problems. Connectivity, which is a very big problem in the Global South. Flexibility and personalization of services, which can either be aided or harmed by digital mechanisms. Safety, privacy, and confidentiality, which I'll leave alone because many will cover, and I am not as much of an expert in that. And then generally, the therapeutic quality of relationships with mental health care practitioners. So research shows that both the practitioners providing mental health care services and those receiving it have very serious concerns about quality of telehealth services related to mental health. This relates to the point about the importance of regulations and international standards. I'm using one very specific example, but it could apply to many things that have been said separately. Then on the digital divide, I think I just want to make a point which emphasizes how crucial this is. Sometimes when we come up with a word which describes a problem well, then we don't realize how severe it is, right? So in Eswatini, where I work, there is one psychiatrist in the public healthcare sector, period, for everything, right? The idea that we can resolve all of the problems of capacity through digital health needs to be constrained by the understanding that there are very, very severe problems with access to provision of services as well as access to technology. And on the digital divide point, I think that it's very important for policymakers and for governments and for NGOs to take this seriously. It is not a gimmick, it is not a qualifier, it is a fundamental aspect of whether or not we are here talking about only benefiting people who already have access with a different form of access. Thirdly, when it comes to criminal law, I'm very thankful to Dr. T for having connected to many different things. The ICJ published in March a set of principles, referred to now as the 8 March Principles on Human Rights and Criminal Law, covering many different ways in which states criminalize behavior, from sex work to gender recognition to poverty to homelessness to abortion to forms of drug use. These principles set out the international law standards that have been brought together from different UN mechanisms and basically show that the criminalization of various things across the world causes a frustration of human rights, including the right to healthcare. And the really serious thing to be raising here, as Dr. T has raised, is that the critical issue for especially marginalized persons is the documentation that they need to access services, and the fact that documenting their existence actually sometimes detracts from their willingness to access services. So when we speak to trans rights activists in Lesotho, they say, well, we would like legal gender recognition, but we're also very worried about identifying ourselves because we fear persecution. And it's a problem that has to be engaged with in a very serious way, and it's a problem that would have to be dealt with. Because there is a direct line between documentation and criminalization of marginalized groups all around the world, which needs to be taken seriously in this process. And the last point is on criminal accountability, and I'm sorry that I have to raise this, but it's just too apposite given the fact that it's happening now. There are reports in the media of Netflix making agreements with countries in Africa to not scream content on LGBTI-related issues. Now, unverified, I don't have confirmation and everything like that. I'm using it as an example. Why? Because many of us of my generation do get sex education from things like Netflix. We watch literal programs called sex education, and then we learn things. Now, the issue here is that big corporates that are operating in the space of technology and on technological platforms have control over what we do and don't hear all over the world, and they need to be held responsible. On a quick Google yesterday when I read this news story, I can't access a human rights policy that Netflix has at all. And if they do have one, they're not making it very easy for me to find it. So this is linking to the point about accountability, and I'm using the example as an access point. ICJ has a lot of experience in Asia and Africa in working on issues relating to social media companies and the real difficulty that there is in holding them accountable, even for policies that do exist. Now, the report very well covers the corporate responsibility to respect and the state's duties to protect, so to regulate these companies. Regulating them is very difficult for any country because they operate on a global scale, and we need to be able to improve that. Secondly, we need to make very clear, specific guidelines for these companies. It must be very easy to complain about something on the website of a company that is interacting in digital health in any way. In most ways, it's not the case. This, by the way, would be much less of a problem if we were talking about digital health proliferation through state provision. But it's not normally the case, and especially in the global south, that that's happening, as Dr. C has said. We also need organized civil society to be able to understand and report and represent society in reporting to hold companies accountable. We need states to be equipped to monitor through institutions that operate independently, and it's the same issue with privacy. And we need to worry about people's willingness to sacrifice their privacy being really high in many places around the world. Now, it's true that we shouldn't only focus on privacy, but my suspicion is that most people don't know how much you sacrifice privacy by using even WhatsApp or Google. And it's an even bigger concern when we're moving into the realm of things that could result in people being criminalized. What we have to do is something that is also part of a broader movement to ensure businesses can be held accountable for human rights abuses. And the standards on that in international law are frankly inadequate at this point in time, and organizations like mine are advocating for their improvement. But what I wanted to say is that we need to try and push for very particular guidelines to say that if you're a company that wants to communicate to us that you should be able to profit off of digital health, you should very clearly set out to make it easier to hold you accountable. And if you don't do that, you should not be permitted to operate. And we should make sure that there is pressure on you to stop operating in the space unless it's easy to hold you accountable when there are potential human rights abuses. I'm sorry that I've taken more of my time probably, and I'll hand over.
We shall revisit your exceeding in time, but your points were very relevant, important, and extremely live to the situation you're living in. I'm going to move you away from lawyers and take you down to the community, to a rising star whose name is Joyce Ouma. Joyce Ouma is working as an advocacy and campaigns manager at Y+ Global, but she is one of the rising young advocates in the HIV field in very many important spaces in the Global Fund Communities Delegation, the first council by the Global Fund for Young People, and a very passionate advocate around health issues, human rights. So Joyce, we're turning over to you to get a perspective on, you've had a look at this report, representing an important constituency of young people living with HIV, who I must say are the flavor of the day now in terms of donors and funding. What's your take around the use of digital technologies in terms of inclusion or exclusion of young people? And do any of these recommendations resonate with what you see on the ground? Over to you.
Thank you very much, Alan, and thanks for that amazing introduction. You didn't even have to read, wow. I'm really excited to be here, and I just, actually, as they were speaking, I just realized I'm the only person who is not a lawyer, but it's a good thing.
Yet.
Yet, wow. Yeah, thank you so much for having me, and thank you for this opportunity to speak on behalf of my constituency. Yeah, as I was reading through this report, I was almost sure I was going to miss a few aspects that are very important to my community. the gender digital divide, the issue of young people. I was sure the report was going to be very long and I wasn't going to read it. But kudos to Dr. T and everybody who contributed, because the report is an actual reflection of what is happening. It has a way of putting together everything that matters, all those that were considered primary, those that are considered secondary, including the issues that are affecting various communities. The report spells out young people. The report spells out adolescents. The report spells out the inequalities and how they link up to adolescent girls and young women, and I couldn't feel any more represented than that. So thank you very much for that, and to everybody who contributed towards that report. I think one thing that came to mind when I was asked to speak on this topic was digital technologies have always been here. Why are we talking about them now? Why are we specifically spotlighting them now? I've been on Facebook since I was 20. Well, that's not a long time ago, but it's 6 years. But I've been on Facebook. And all this time, every time I Google something, my Facebook knows what I want to look for, even before I look for it. You talk to someone about wanting to buy a new phone, and the next thing you're getting pop-ups. Oh, Samsung, they have this, this kind of promotion going on. And I've never understood how that works until I recently had something called the algorithm. You find a chatbot asking you, please verify that you're not a robot. So a robot is asking you to affirm that you're not a robot. And we click agree. You do not know where this data goes to. You do not have any idea. And quite frankly, as young people, sometimes we really don't want to care. But we want to feel protected at the end of the day. So digital technologies are coming in to bridge a gap. They're standing in a gap that has been there for a very long time. For a very long time, young people have called for adolescents and youth-friendly health services, but we have not been getting this. But then COVID happens. And like you said, everything falls right into place. Who knew doctors could work from home and just tell you, hey, you need to take a pill at this time. Make sure you eat, make sure you do what. And so the digital technologies and everything that is around digital health is bringing us closer to universal health coverage. It's bringing us closer to self-care, to attaining self-care, where we as young people can take control of our own lives, can take control over our own health without necessarily relying on a doctor or relying on anybody else. And just like the report captures that, we are able to get services from wherever we are. We are able to get medicine dropped by drones in some places, which is quite fascinating. But then, if at all I do not feel like the facility is not a friendly place for me to go to, I still have options. So again, it takes us back to digital technologies are not here to replace the mainstream. I can tell you for a fact, I'm looking around the room, and for those who are online, it is my hope that you're joining in with a phone or a computer. But most of us, especially from where I come from, did not have our first smartphones until we were around 20. But the report still also talks about the adolescents, and we still also have to continuously factor them in. That while it is the new kid on the block, while it is assumed that all young people are social media gurus, it is important to maintain that digital technologies are not replacing, but are complementing the existing health systems. There are those of us who still prefer one-on-one contact, or there are those issues that a chatbot cannot answer, but a doctor at the facility can answer. So those are some of the things that we need to constantly keep looking into. So I recognize the threats that come with clicking agree, recognize the threats that come with saying, oh, I am not a robot, or asking online, how do I do this, how do I do that, where can I get abortion pills, or who do I talk to in such instances. And just like I mentioned, sometimes Google reads my mind in a very weird way. But one thing that I constantly realize is that behind these most technologies that we are having right now, the TikToks and everything, there is a young brain behind that. The young people are the ones who are creating these apps. The young people are the ones who we constantly work with to come up with a chat section or an AI that is going to respond to some of the issues that young people would want to talk about but are not confident enough to share with their other partners. So it's very important for us to, moving forward, continue engaging the young people. Part of the recommendations that come from the report is the meaningful participation. And I would just like to echo that meaningful participation of all partners. And now specifically, the report has singled out young people as the ones who urgently need this and who are also mostly impacted impacted by the digital technologies. They are the creators. We have the solution. Might not be me, because as I've said, I just click agree. But then there are definitely other young people who are very well seasoned, who have the skills, and who are the ones who are actually behind these particular technologies. So there is a question that I was asked, the second part of the question, on how young people can be protected online. And like I mentioned, sometimes we do not think about being protected. We do not even think there is a risk. So there are two things that are involved here. There is the secondary protection that has to come with, the regulations that need to be put in place to ensure that even if Meta collects my data, they're not going to be using that data to make money or other things. That is not for us to figure out, but it is for us to actively engage and also to contribute to how these regulations can be put in place. We need to ensure that as young people still have access and control to digital technologies, to platforms, to connectivity, to infrastructure, to mobile phones, and all that. Without that, we are going to be moving with a big team of young people in the urban areas, but still leaving out a very big batch of young people who are from the rural areas. There is need to provide digital literacy. Again, access is one thing, control is another thing. Someone mentioned to me that if you want to know who you really are, just check your search history. If you want to know what you really have been thinking about, check your search history. And it has a way of showing you exactly the kind of thoughts that are running into your head. And the internet learns you and gives you what you want. So when we're talking about digital literacy, you tell a young person, if you want this kind of information, this and this is where you need to go to. This is where to get a legit, reliable information. Then that is a step towards digital literacy. And almost finally, I like to say, I'm hanging with lawyers. But my final point, the internet has constantly become a basic human right. It's sad that not everyone has access. It is sad that not everyone is at par. It's sad that not everyone is where we are with this with the digital migration sort of. But there is need to advocate for the provision of that. While we are advocating for those who are already advanced, there is need to put a cell phone, put internet, and make it accessible to every young person. And finally, we need to promote individual action at a primary level, ensure that the young people know their rights. Do these rights that apply offline, do they still apply online? We need to know that as young people. We need to also be engaged to meaningfully participate and also to really put our skills to be used and also to respond to the digital surveillance and many other new terms that I've learned while going through this report. Thank you, Alan.
Thank you. Well done, Joy. And now, Timothy, you only have less minutes, and do not pull the final and very closing points on me, but would want to hear from you. Moving forward, what are the key priorities for developing stronger global, regional, and national rights-based standards on digital health? And I know they kept saying that the report has 2.5 pages recommendations. There are actually 23 recommendations. I counted and I was like, these are the most recommendations I've seen in a special rapporteur's report. So, and number 23 is where your question came from. So that was the last thing that was recommended. So how do we make a rights-based approach possible in this?
Yeah, thanks, Alan, and thanks, everyone. So, yeah, as you've rightly said, being the beauty of being the last speaker is that everybody has said everything that you want to say. So you're basically using 1 minute, saying just concluding remarks. But, yeah, something just to think about as we move forward. Now that we have the report, I will say that it's important that actually the recommendations that are in that report are actually implemented. That as civil society, we actually pick the recommendations that are there and see how do we advocate, how do we work with our governments, how do we work with different actors to see that these recommendations are implemented. So one thing that I've picked, which is important, and I think stakeholders need to be able to think about, is the need to ensure that the conversation around human rights when it comes to digital health is still ongoing, that we continue and ensure that that conversation, so when you talk about digital health, we still also talk about human rights. We ensure that it's part and parcel of the same conversation. And I think the second bit that I'm picking and something that will be important as we move forward is now the issue about regulation. And this one now is where the stakeholders now need to come together and to be able to ensure that we have the relevant regulatory frameworks for digital health environments to work in. And this is using the report, look through the report, see in your country, do we have any gaps within the regulations as a regulatory system? Do we have any gaps in the legal framework? Do we have any gaps in the policy frameworks? How do we use the recommendations that are there in the report to be able to seal and fill the gaps that exist within our system and ensure that we have the right environment for digital health, that all the risks that have been mentioned, all the concern by all the communities are actually being addressed through the regulatory system that is there. And I think now also importantly, that one ties with the governance framework. I think colleagues have mentioned around ownership of health data. How is health data to be governed? And this is also a part where as civil society, as government, even we need now, as civil society, we need to be able to be in the forefront pushing for stronger governance of the system, holding our governments to account, holding private actors to account when it comes to health data governance. So that is something that I think the report comes at a very critical time. It comes at a time when we are actually now recognizing that technology is actually moving fast. Digital technologies digital health technologies are here, and this is a conversation that we need to continue at both in country level, at the international level, and even at the regional level with the different actors on board, and ensuring that every recommendation, everything that is actually being put forth is actually being looked into, all the concerns of the different communities are looked into. So Alan, yeah, that I wanted to be brief, and I've been brief.
Thank you, Timothy. That's only because I sign your paycheck. Maybe that's why you are brief. But I don't have control over the others. But thank you so much for the intervention. Timothy is my colleague at KELIN. He leads our work on HIV and TB and also health and governance. So we want to turn it over to the audience. You've had a few reflections from different panelists from different sectors. We have got over 150 people online. I'm expecting 150 questions in the chat box, but also let's start off with folks in the room. There's a microphone that will go around. Gladly, I seem to know everyone. Turning to my good friend from the Global Fund. I'll allow you to introduce yourself so that I don't cause any injustice to your titles. And happy to take more names. If you're online, please use the question and answer chat option. That will be able to allow you to raise a question. Over to you, Brice.
Hi, thank you very much, Alan. So my name is Brice Bambara. I work in the political and civil society advocacy of the Global Fund to fight HIV, tuberculosis, and malaria. So thank you very much for the panel. And this is more a comment from my part. I have to admit that I was expecting a panel that was going to be interesting, but not that interesting. You know, for me, I come from the civil society side, so, you know, when you're talking about rights, this is something that, you know, we hear about every day, and I'm just, okay, you know, lawyers, they're going to talk about very technical stuff, and I was pleasantly surprised. So there's some words that kept coming in your different intervention that I remember, and I was very happy to hear because I was hoping they would come out. You talked about connectivity, non-discrimination, accountability, opening up civil society spaces, communities, civil society, privacy, digital and data literacy, and there's quite a few that I kept writing down and all that, and I want to say thank you for that. Thank you that it's appearing in the report, because it's very important. And if there is one thing that we see in our daily interaction with our partners in implementing countries, is that the civil society space is shrinking up. And issues related to human rights and gender are increasing. So very happy that you made all these things appear in the report. I'm looking forward to reading it, not just for work, but for my own personal knowledge. You've also mentioned that everybody has a part to play. It's true. One of the panelists mentioned lawyers, judges, and parliamentarians, but giving some of the human rights and gender-related issues that we're facing, I think it's also very important to bring on board more religious leaders and also cultural chiefs as well. And I was very happy to see that Joyce was on the panel, because we need to make space. We need to make more room for young people. Correct me if I'm wrong, but I believe that by 2050, the youth would have doubled. And like she mentioned in her intervention, they're the one that really understand technology. Because me, for example, I'm noticing that as I'm getting older, I'm understanding less and less technology. So open up the space for civil society, but also for young people. Thank you very much.
Thank you. I'll come to you, Esther, and just don't want to get Dr. T off the hook. There's a space here right in the middle for you, and I'm sure there are questions that will come your way. Yes, I will suck every minute of you that is available physically to me, so please. No, just join us. I can see there are questions coming online that will require your intervention, so I'm going to come to my co-chair, the Human Rights Reference Group, Esther, but let me pick two questions online. The first one is from Peter Owiti, who says, we are appreciating digitalization of health provision. The challenge is that we end up not owning the data. Who is supposed to train healthcare providers that the health data is personal and they only use it to provide service and not own it? So anyone can take that up. And then we have Jean Kamalt, who says, thank you for this excellent panel and discussion. A number of presenters spoke about the importance of meaningful participation, including terms of generating evidence to shape rights-based policy recommendations. Would it be possible to elaborate on what that participation looks like in practice? Thank you. Over to you, Esther.
Thank you so much. My name is Esther Kismudi. I'm a human rights lawyer, Chief Executive of SRHM Journal and co-chair of the UNAIDS Human Rights Reference Group. I participated in the development of the March 8 principles, and I was very happy to see the connection between the principles and Dr. Tlaleng report and the intersectionality among these very innovative incredible years of evidence-based work that is coming out, both the Special Rapporteur report and the 8th of March principles. So it would be very nice to see how to take forward these human rights-based principles in the public health sector. Many of us were, for example, at the Family Planning Conference in November in Thailand, when, as Dr. Tlaleng pointed out, there is an opportunity for digital interventions to boost up availability and accessibility of health services. However, the safeguards are not there. And when you heard private sector public health professionals talking with great enthusiasm about public health interventions and the opportunities of digital health, when the questions popped up about safeguard security, connection to criminalization, where the safeguards are, where the human rights are, the private sector public health actors didn't even understand what participation means, what privacy means. So I think we have almost no time to catch up with the speed how public health interventions, different digital apps, public health apps are popping up without any consultation with population groups that the public health interventions are addressing, let alone linking it to criminalization. So, and when we talk about accountability, very often we talk about state accountability. But I think we really need to enhance the accountability of private sector as well, and how we can enhance implementation of the reports and the principles around it, because we really have very limited time to catch up with the speed of the development of these interventions. Thank you.
Great. Are there any more interventions on the House? So keep thinking through, and I'll come to you. You'll give your response and your concluding remarks. So just keep that, and you can pick any of the comments or the questions that come up. So we'll take 3 more and then come back to the panel.
Thank you very much. And I know part of my question has been hinted from the online team. My name is Evelyn Carrijo. I'm a global health specialist, and I've been working in the health development space for over a decade now in Africa, and mainly in Kenya, where I come from. I'm now in Geneva studying digital business, which is a detour from a traditional career, and which really forms the basis of my question. Do we have any recommendations or frameworks around upskilling of health workers so that they can keep up, with the rapid technology, with the digital ecosystem? Because even if you look around the room right now, we have CSOs and human rights organizations like KELIN doing a great job championing for rights. We, on the other hand, have private sector organizations racing to reap their billions from digital technologies, including in the health sector. But what about human resources for health? What about the health frontline workers? How do we ensure that we have more Dr. T's in the space who will be championing for accountability, privacy, data protection, if health workers are being trained in the very traditional ways, curriculums that have been used since before many of us were born? Do we have any frameworks around upskilling of health workers to be at the front line of championing these issues so that we don't have just other sectors without human resources for health being at the forefront? Thank you.
Awesome. Has that triggered anyone else in the room to want to add anything? Going once. There we go. 2 hands. So for ease of the mic, we'll start right there with Rebecca. Thank you for coming.
Rachel.
And then Rachel,
Rebecca's
sorry.
my sister.
I was close.
Yes, of course. I just wanted to pick up on one of the points that Tim Fish-Hodgson made, and that is the importance of accountability, which we all play a part in particular here. We know about the strength of civil society. But I'm wondering, how do we really make that happen when we're dealing with these incredibly powerful, wealthy firms that are often transnational in terms of their incredibly complex structures? And I feel like there's very few of us in terms of the power that we have to be able to counter that real financial clout that the firms have when they go to our politicians. I think our youth need us to do that, because we can't leave them a world that has been taken over by the private sector with its own goals, which of course profit maximization, and they're not human rights, and that's not to malign them, that's the reality of capitalism. So I'm just wondering, Tim, easy question for you, a good accountability mechanism that holds a strong industry accountable. Thank you.
Let me actually quickly just take the mic quickly while I have it. Maybe I'll answer Evelyn's question. Nice to meet you in person. Brian Wong, I used to be with the Lancet Financial Times Commission on Governing Health Futures, and I do some work with WHO now. But to maybe answer your question, there's 2 bits of work that WHO is actually doing. One is on developing a digital health competency framework. One is, so that's led by IDARE, which is the International Digital Health and AI Research Collaborative, and WHO. One of them is geared at policymakers, but health workers are another tier of that. And then there's another EU-level project called the Be Well Project, which is about digital and green skills of the health workforce. So do check out those 2 things.
Thank you.
All right. Hello, everyone. Good afternoon. I'm Dr. Josh San Pedro from the Coalition for People's Right to Health in the Philippines. I'm a physician and a human rights advocate as well. So I just want to mention, although we did make an oral intervention yesterday during the dialogue regarding the aspect of surveillance with regards to digital innovations and new technologies. I just also want to add on what was already asked and mentioned, that when we talk about the aspect of the digital innovations, especially during the pandemic, it's mostly also, aside from the tech firms and the private sector, a lot of it, especially in developing countries, have been utilized by the state. And the state has technically monopolized a lot of the responses for the pandemic. And in many instances, it may not, of course, adhere to a lot of human rights principles. They have their own sense of what to do, especially in developing countries that have had pandemic responses that have been securitized or in some instances even militarized. So the perspective sort of shifts, of course, without that human rights framework. So to cite an example, for example, in the Philippines, contact tracing data, which has been, very much revolutionary in our approaches in the pandemic, there are instances whenever it takes a securitized approach in which the contact tracing platforms they used police software because they correlated suspect cases and contacts to suspects and accomplices. So they use the same system in applying the technologies to crime fighting in how to apply it to health technologies. So these aspects of health surveillance or surveillance as a whole being applied to health is, of course, very problematic and without the human rights frameworks. But I do want to ask anyone in the panel, how is it that we do so, especially when these states, of course, when states, of course, do what they want to do, but at the same time, when you appeal to health authorities, they also do not have that health and human rights framework. So you really only can rely on the national human rights organizations. But again, with a shrinking civil society, it's become very difficult, of course, to assert to states as well as health authorities as well. Thank you.
So I think I walk the people online, but I'll first give the panelists a round to sort of respond to this and then see whether I can take another round specific to online people. So let's start over with Mandeep on any of the issues you'd want to pick: accountability, what does participation or rights-based look like, and how are we taking care of the needs of healthcare workers on one point to have them have the right literacy, but also to help them understand the expectations that health users have about the data they collect in health facilities. Any of those?
Yeah, thanks so much. And I just want to pick up on another resource that, to add to our colleague from WHO. So I think 2 years ago, UNDP, together with UNAIDS, developed a guidance on the ethical and rights-based use of digital technologies in HIV and health programs. So I think we do have some resources, and the report gives us, actually, I was just thinking I'm going to now read the report again and go back and check what we put into that resource and probably update it to some extent. We have some tools. I think the question is to implement these tools. How do we implement them? And for HIV, the two biggest funders of HIV programs in countries are PEPFAR and the Global Fund. And I think these resources should be mandatory, and trainings using these resources should be mandatory in GC7, which is the next grant cycle. In PEPFAR programming, it needs to be part of their COP going forward, that country plans need to include this. So I think at least in the context of HIV, there are some vehicles. National, countries also fund their own HIV and health responses. There should be a dialogue, maybe led by the UN with WHO, the joint program at the country level with ministries of health, saying that we've got these resources, you should use them, and this should be part of the package that's training package for health workers. and community health workers as well, because there's a huge cadre of community health workers, as we know, and they also need to be having the capacity on these issues. They're the closest, they're on the front line, more so than people in the more formal health sector. On the corporate accountability, there really need to be, I would love to see some ICJ principles on corporate accountability in the digital space. So just to put something back to you, because I think the principles on criminalization, which UNDP contributed to, are really, really brilliant. But again, we need to use them. But I do think we need principles on corporate accountability. It's something that's talked about. At UNDP, we've got a program on business and human rights, and accountability is part of that, but some principles on what this means in the digital space would be really, really welcome, and I think then we need to get around to applying them. Thanks.
Awesome. Joyce?
Thank you, Ellen. So naturally, I'll take the question on the participation. What does participation look like? And I'd like to say that participation looks like diversity, recognizing that we are not all the same. As I stand here or as I sit here, I represent various constituencies, young women, young people living with HIV, young people from sub-Saharan Africa, which apparently is a whole constituency on its own due to the inequalities and all. So it is important that in any engagement that there is need to ensure diversity, to ensure that regardless of sexual identity, there is need to ensure everybody is on board, and hence that also speaks to inclusion regardless of what someone or who someone identifies as. This is just to re-emphasize on the need to leave no one behind, regardless of where you're coming from or whatever part of the world you're in, that we need to move as a team. The digital migration is happening, yes, but it is key to ensure that even those at the rural areas or in different hard-to-reach areas are also being very ethically and meaningfully included. Generally, as young people, we have constantly called for the ethical and meaningful engagement of young people. And as Alan mentioned, that now young people are the new, the most of the focus is on young people. But it took the HIV field a while to realize that they needed young people on the table to also guide and steer the HIV response. So I'm glad that this report is a first step, I think, because there hasn't actually been actual intention, and now with this report also strongly capitalizing on participation, this is a good time to also ensure that young people are being engaged, not just as beneficiaries, but as stakeholders, and also as key experts on this particular topic, including the civil society as a whole, and mostly youth-led organization and youth partners. Thank you.
Any thoughts, Dr. T?
On the healthcare workers, it's actually a big passion of mine, the issue of medical curriculum, and it's very hard to get colleagues to see why it's important to update the curriculum, but also change the methods of teaching in medicine and in nursing as well, and the other allied health professionals. We are not taught human rights at medical school, so I still had to actively, nurture my own interest in human rights, because I realized pretty early that every day there are decisions I'm making that are either protecting human rights of patients or enabling other violations, even in other spaces and moments where I'm no longer even there, because of the decisions I'm making as a doctor. And so I think it's important to really demand that participation includes healthcare workers. Often with many of the siloed approaches of healthcare, it leads to the fracturing of the system itself, but it also leads to a fracturing of the capacity of the healthcare workforce. Without a basic understanding, a foundational understanding of human rights as an undergraduate, even postgraduate, it will be then even more difficult to translate those approaches to digital care. It's also important to recognize that, which I see as a criminalization of medical practice that's happening in a lot of the countries, where if I see a patient who's transgender, if I see a patient who needs abortion, or an adolescent who comes for contraception without parental consent, if I don't report those to police, I myself then could be charged. And that's a problem, and I think that's a risk that we are not responding adequately to as healthcare workers ourselves. But again, we've just come out of a pandemic. We are completely exhausted. Maybe it's time we get fought for as well. And that advocacy efforts include ensuring fair and healthy working conditions of healthcare workers, because those are the same conditions in which patients need to get healthy and well. And public health systems don't see investment in human resources as something that they need to be continuously doing. And I'll give you another example. You know, like Joyce was saying, digital and technology has been always there in medicine. A very simple automated BP reading machine, that's technology. But a lot of it has been in the hands of healthcare workers in diagnostics and screening, in prescribing and in surgical operations like robotic surgery. You know, that's AI, that's digital tools, that's innovation. But now you have a situation where those tools are now in the patient's hands in a way that it has never been before. And so there's a lot of, battle, friction between healthcare workers where patients come and they're Googling the symptoms as you go through them with them, and they're Googling the diagnosis as you go. So there's a lot of just information, education, communication that needs to accompany the implementation and the uptake of tools in a clinical setting that should be helping to improve health consultations and not threaten or bring new frictions into that system and distrust. And I think the criminalization of medical practice is a real threat across the board. And so the tracing and the ability of certain states and non-state actors also to put pressure on healthcare workers is something that, for me, I think is a real threat, an emerging threat in the context of legislation that's attacking literally the practice of medicine, but interfering with our own ethics as doctors as well in terms of confidentiality when it comes to patients. I think that's the one I'll stop
Awesome.
at.
Team, one thing on accountability, and then the date when you'll do the ICJ principles.
So to Mandeep, thanks for giving me work. To Rachel, because the broad question on corporate accountability was about that. I think that we saw this with vaccines also, right? We need to admit that international human rights law, when we formulated a duty to protect, and this has been understood, it wasn't formulated in a way that it was supposed to be dealing with companies that are as big or operating as widely. And it definitely wasn't formulated to control companies that were more powerful than states, and in many instances are actually regulating state behavior because they are very much in charge of those relationships. And so from a human rights perspective, we need to radically rethink what we mean by the duty to protect. And it has to do with international cooperation of a different kind, and it's a very, very challenging problem. But I have to step out of being a lawyer and say that the only realistic way of holding corporations accountable is that people generally realize that they have to. And one of the problems is that these are very sexy companies that people like. And we have not won the battle of making people realize that Netflix is, I should see Netflix like I see the government. I should see Facebook like I see the government, with suspicion, because they have a lot of power. And it's not because I have an agenda against either one of those companies. It's just literally true. These are powerful entities. I want to make a point about the health workers thing was covered, but moving to health authorities, it's the same thing because it's similar people who are hired, who've been in public health environments. And then moving to the WHO, there are currently many more people on this stage than the WHO hires to do human rights work. And that's shocking. Now, we experienced and continue to experience in the negotiations for a pandemic treaty the effects of that. The reason why civil society organizations, and there's yet another set of principles we're publishing, which several people here have been involved in, are publishing human rights principles for public health emergencies, is because that we are very much predicting that the pandemic treaty does not protect human rights, because nowhere in the health environment, global, local, national, at universities, are human rights taken seriously. And that's a fundamental problem. And then the last small one is on criminalization. I think that human rights lawyers and civil society activists have been too scared of touching criminal law for a very long time, because criminals are bad and they're bad for your image, and you're already talking about defending people that other people don't like. And we need to be less scared. We need to say that actually fundamentally criminal law is made in societies to repress and oppress marginalized and vulnerable people and political dissidents, and the space for it should be much, much smaller, and the justifications for it need to be much, much higher. And that's what I think that these principles, the 8 March principles, start to push at least the ICJ and those who've signed on them to the principles in that direction. And we do need to explore further how to advocate around that and to push even further, because it's a deep problem in human rights.
Thanks. Anything, Tim?
Yeah, so maybe just a parting shot that, and more around the participation issue. So I was just thinking that health is a very important aspect that we cannot just leave that conversation around it to chance. So that's the importance, I think. I was just trying to think around why we should be involved, why we should engage. We can't leave this conversation. We can't just let it be the way it is supposed to be. We have to shape the conversation. And one thing that I wanted to mention there is that the importance of, again, issues around, for instance, digital literacy, importance of information, for there to be meaningful participation. And I think these are really captured well in the report. So importantly that these programs are actually taken seriously to be able to ensure there's meaningful participation. And I think lastly, on the aspect of surveillance, I think I do agree on the need that for these, for digital health interventions to actually succeed, there is that need for there to be trust. And I think if now we have governments, we have instances whereby health data is actually being used to be able to criminalize people, profile people, already create put people who are already vulnerable at a more risky situation, that becomes an issue. And I think that is an important an aspect that actually has to be taken seriously if we have to ensure that the interventions are succeed. And I think also that is also the recommendations around surveillance and that function creep within the report. Yeah, thanks.
Thanks. So we are almost done with the question and answer. I have to squeeze in these comments and questions from the online colleagues, and then we'll come back to the panelists to respond to it, and then in their closing, not to give us a speech, but to tell us one thing they're going to be taking forward either individually or if they have authority to speak on behalf of their entities, what are they going to be able to do? So let me start with Ethel, who says, and I don't want to cut anyone's comments short, she says, thank you for the great presentations. How do we ensure that data generated from international health research companies and the big pharma is owned by host countries in Africa, and there is direct benefit to the research participants? We owe it to the developing countries to invest in current technology and put a stop to e-waste and technological dumping to poor countries. How can we ensure this is effected? Wow, Ethel, that's a hard question, but I have an able panel to address it. We have a question from Cameroon, from Magbo Welisane, and says, I'm Welisane from Cameroon. As a young emerging leader with Y+ Global, I'm sure, Joyce, you may know that person. I'm very pleased to listen to Joyce Ouma share perspectives of young people. How do we get young people involved in holding private companies accountable? So the youth want some accountability, Rachel, and particularly to private companies. Maybe you should work with them. And then my good friend and a friend to all of us here, Kene, who has worked previously with Mandeep and us in other spaces, saying, moving from a great report and excellent recommendations to national policy and diligent implementation is where the rubber hits the road. Even when there's political will at domestic level, sometimes governments do not always have the capacity to translate UN reports into effective policy at domestic level. So he suggests that are there any examples around what Mandeep spoke about on convening various stakeholders, including across government, civil society, local tech, that could be implemented in the global south and ensure that there's a clear action plan for the Special Rapporteur's report? Nomtika, who is from GNP Plus and a quite member of this consortium, has a very long comment. Nomtika, if you're listening, This is making my life hard. My comment is open to the panelists on the digital empowerment literacy. This is an important discussion, especially because really it's foundational in how communities understand not only digital platforms, but their own rights. So, one, how do we ensure we have a meaningful approach in developing digital empowerment mechanisms, especially for young people and often disenfranchised communities? I think, Joy, you spoke a bit to that, but you could expound. Second, it appears digital literacy is a necessity for duty bearers as well, governments, decision makers, etc. How can we make this an integrated approach where human rights activists, communities, and decision makers learn and design solutions together to ensure community-centered governance? Then lastly, Sia Edward says, not a question, but we've had advancement to technologies that might promote harm to sexual minorities and key populations. Now that advancements of technology promote many lower middle income countries to use data, how do we navigate challenges around structural barriers in the reality of digital innovation and the rights to health? So I think I have covered all the online questions, and you could pick one, but as you pick one and give your closing reflection, just let us know how are you taking this forward. And Dr. T, don't tell us you've already released the report and now you're moving on. Let us know how that will move forward. Tim, I'll start with you so that you don't use the line, everyone has said everything I wanted to say.
Okay, thank you. So I'll pick the question around research data ownership. Ethel, I think looking at it, and I'm thinking that the best way to be able to ensure that that is actually addressed is now through regulation, the policies, the law at the national level. So how do researchers, how do research institutions, how do communities actually participate and ensure that they are working to have a strong regulatory system within a country that actually addresses the issue? How are the issues addressed within the law? How are the issues addressed within the policy and the regulations that exist within the country? And just maybe to think to Alan about your moving forward, what are we going to do with regards to the report? So one thing that we want to be able to do on our part is to be able to take this conversation at the national level, continue having conversations with young people, human rights lawyers about the recommendations that are in the report, and engaging the different stakeholders to see what needs to be done, where are the gaps, and how should they, what role should they play in pushing for the implementation of the report. So that is the key aspect on our side, ensuring that this is cascaded within national levels, and I will encourage different actors to also do the same, and those with the ability to be able to influence the global norms and the international norms to also use their spaces to do the same. Thanks.
So I'm going to start with something Joyce said. Joyce said that I am whatever my internet history says. So I'd like to tell everyone that I'm a professional footballer for Arsenal. And I have only two things to say. That the issue of how to get people involved in holding corporates account is a global issue, and it's in every area of work that we're working in. It doesn't matter whether we're talking about prisons. It doesn't matter whether we're talking about roads, education, healthcare, digital technology. It's always there. It's a challenge for our generation in general, but if we're going to reverse the effects of climate crisis, to just not let corporations run free. And our states are unfortunately not going to do it unless we lead with it. And so I don't have an answer to that. It would be quite arrogant to present an answer to such a big question, but I think it's important. One thing I'd like to compliment Dr. T on with the report. Many of the UN resolutions and reports coming out about digital technology are far too imbalanced when weighing the risks against the benefits, and basically saying it's a fait accompli that there are many benefits, but we just need to worry about these one or two things. And one of the things that I like about the report overall is that it quite in a very balanced fashion says we have to look at both of these things together. And it's very important to not get carried away with, for whatever reason, overemphasizing the potential benefits and underemphasizing the potential risks involved. So thank you very much for that, and I hope that this has an effect, a real meaningful effect on the way that we are discussing digital technologies and human rights, including in health rights.
So I'll take the multi-sectoral approach answer, because part of the right to health, it's defined as not just accessing health care, it's also about underlying determinants of health. And an approach that I've taken to my country visits, and this is one way of taking these reports and making sure that they have meaning and that the recommendations also have impact, is that part of the assessments I do in countries that I visit is actually looking at past recommendations that the mandate has had on a particular issue, but also my own recommendations in the last 3 years, and actually seeing if any of them have been taken up by the governments I'm visiting, and also then seeing what technical support and assistance I can provide where there's, of course, political will to make a difference. So yesterday there was a lot of member states who were just like, we don't even know where to start on a particular issue. And part of the role of being the special rapporteur is providing that assistance and working across, of course, with other UN agencies. So the convenings are really important, because I think we have a moment in time now where we don't have to be only reactive. We can actually proactively show states and model what it is about governance and regulation and human rights. And it is worth repeating, that if you use human rights as your litmus test around the COVID pandemic response, we failed, all of us. And so if we don't want to repeat the failures, we do not have a choice but to center human rights in the approaches to digital innovations, technology. Doing the consultations and taking the time required to figure out what that is not going to slow innovation. So we don't have to worry about that. We actually need just some time to regroup and take the time it requires to have proper consultations, but also resource civil society organizations which didn't necessarily see themselves or their work evolving in this way. Okay. And so that's what's really important, is to support and resource, and we can do it all at the same time. I think we just have to be strategic on who's doing what at what level and to what end, and I think that's the best way to approach it.
Thank you so much. I think, thank you for the question, and also shout outs to my Y+ peeps who are watching. Yeah, the messages are coming. I feel very well supported, and thanks, Felisane, for the question on how we can hold farmers accountable. So I think this is a question that has already been largely responded to, but with the youth touch, this is something that definitely we are going to be taking up. At least that's one of our next steps going forward. When we were in school, we were being taught that where there is a right, there is a responsibility. And as part of the things that we are taking in as youth-led organizations, and my constituency is sending in reinforcing support, that we are ready to take up the report. We are ready to unpack it to our constituents, to have an understanding about it, use it as an advocacy tool, and most importantly, also use it to advocate for our digital health and rights. As Dr. Tia said, that member states met yesterday, made a few statements. It would be good to know what each of our states committed to, so that we can also start there to hold them accountable from that angle. But my final statement is young people are ready to take charge. We recognize the role that we have to play, not just as beneficiaries, but as experts. Yeah, thank you.
It's hard to follow that. But I am just going to say that there are models of excellent consultation that have led to change. And Alan, I'll point to the multi-sectoral consultations that took place for the report and the supplement of the Global Commission on HIV and the Law, where we brought together different parts of government, civil society, communities, and it would be very easy to add tech companies to that, and to have the kind of consultations that can really drive change. And I think the UN played a really important role in facilitating those conversations and to make them rights-based. And I think this time around, not only would we want to add tech companies, we'd want to have them led by young people as well. And I think that would make it really, make it very powerful. So I'll stop there. Thanks.
Awesome. This is a very big round of applause to the panelists. And before I let them go, and I'm already out of Swiss time, I have to allow my colleague Alexandrina from Privates International to give very quick closing remarks.
Great,
on
thank you,
behalf of
Alan.
the
And I know we're
consortium.
over time and I'm in between people and their food as well. So I'll be really quick. Thank you for giving me the chance to speak. We've been very happy to be able to co-host this event. And I've asked to be positive to end this event. So I'm going to take a sandwich approach where I'm going to have something a bit more negative, but two positives. I mean, the first positive is that there's a lot to build on from the Special Rapporteur's report, and that we're not starting from scratch. There's a really strong regulatory framework. It's not perfect, but it's a starting point, and we need to be able to utilize it, challenge it, and use it for our own advocacy moving forward. The negative point I want to sandwich in, and so many of the speakers referred to it as well, is that the situation is extremely challenging to work on some of these issues between the crackdown on civil society, the criminalization of different communities, and also issues around funding as well, and not having a space at the table for a lot of these discussions that are happening in the shadows. And that's something we have to embed across all of the work that we're doing beyond the advocacy that we're doing on the substantive issues. And so to end on a positive note, which I think is just a reflection of this, the panel, but also the consortium that's behind a lot of this work, is that we are breaking silos. We're bringing different communities together, organizations working on the rights of youth, organizations working on the right to health, organizations working on privacy and human rights and technology. And so that's what we have to take forward as well, and that we can utilize to our advantage, because it was mentioned a lot of our adversaries are bigger, there's more influence, but by coming together, we'll not only have strengths in numbers, but also in diversity that they're lacking. So I think that's something we can take forward as well. So thank you very much, and thank you also to the co-sponsors, the Permanent Mission of Germany and Brazil, for enabling us to have this event as well. Thank you.
Thank you, Alex. A big round of applause. So we are going to segment into lunch, but I just want to give a special shout out to my colleagues who I bullied from the Global Fund to come for this event. I can see colleagues from UNAIDS, colleagues formerly from Stop TB Partnership. Thank you all for honoring the invite in person. The conversation doesn't end here. It continues online, but it also continues over a lunch that is provided, and I believe there'll be, as you walk out, guidance will be given where you can grab some lunch, and then we continue the conversation. Once again, thank you, everyone. I've really enjoyed this conversation. Let's get it into action now. Thank you.